Hello everyone, this is Chris Goodwin with Insurance Pros, and I'm going to talk to you about what startups should know about changes to the individual health insurance market for 2018. Starting with a little history, on May 24th of this year, Blue Cross Blue Shield of Kansas City announced their exit from the individual health insurance market for 2018. Blue KC is the market share leader in the Kansas City area, and they will discontinue offering individual health insurance plans at the end of this year. Furthermore, over 67,000 individuals throughout the Kansas City area will have their policies discontinued after December 31st of 2017. The discontinued policies will comprise all individual health insurance policies originated on or after October 1st of 2013. The company operates in 16 counties in Missouri and Johnson and Wyandotte counties in Kansas. Blue KC cited significant losses and lack of sustainability in the current market as the reason for exiting the market. Since this time, several other insurance companies have also announced that they will no longer participate in the individual market for next year. Humana, Aetna, Coventry, which is an Aetna company, and United Healthcare. All of these companies have cited the current health insurance environment as the reason not to participate in the local market. The remaining carriers, despite the many challenges in the individual market, Cigna plans to continue to offer their plans to new and existing clients in Missouri. There also is a new carrier. New to our market is Centene, who plans to offer plans in all of the counties that were vacated by Blue Cross Blue Shield of Kansas City in both Missouri and Kansas. What you will see is Centene is branded under the name Ambetter. So in Kansas today, you'll see that there's Blue Cross Blue Shield of Kansas City, Coventry, Humana, Aetna, and Medica, some of which are not offering plans in 2017 but still maintain individual health insurance plans. Outside of Johnson and Wyandotte counties, there's Blue Cross Blue Shield of Kansas. Now in 2018, Blue Cross Blue Shield is leaving, Coventry is leaving, Humana, Aetna, and Medica is remaining. And as we mentioned, Centene or Ambetter is entering the market. In Missouri, you have Blue Cross Blue Shield, Coventry, Humana, Aetna, and Cigna. For 2018, Blue Cross Blue Shield is leaving, and these guys are leaving. Left with Cigna and Ambetter. Let's talk about Centene, who operates the Ambetter plans. They were established in 1984. They're headquartered in St. Louis, Missouri. They got 2.9 million covered members and growing in 24 states. They're primarily a Medicaid provider, so they participate in the Medicaid program for a lot of states. They don't have any prior experience in our local market on the individual side, non-Medicaid. And there are not many local contacts here in terms of feet on the ground, as they're a Medicaid only company until recently. Let's talk about the Ambetter network. By the way, you're going to see that a lot of the Ambetter plans are referred to as EPOs or HMOs. The most important part about that is that these are closed networks. So in a non-emergency situation, you do not have access to providers outside of the network while having those services covered. Here are some of the hospitals: Menora Overland Park Regional, the St. Luke's Hospital Group, Providence Medical Center, Truman Medical Center and Truman East, Research Medical Center, Lee Summit Medical Center, and Center Point Medical Center of Independence. So if you are keen on the hospitals in our area, then you probably know which ones are missing. Medica. Now this is Kansas only right now for 2018. Medica is not going into Missouri. Um, Medica was established in 1975. They're headquartered in Minnetonka, Minnesota. They share some back office operations with United Healthcare. 1.2 million covered members in 7 states, and of course that's data pulled from earlier this year, so that's a growing number. Aetna in the Kansas City area, for those who live in Johnson or Wyandotte counties, are offering EPO plans, meaning exclusive provider organization plans with St. Luke's facilities and doctors locally. So with the Medica plans, if you want to remain in network, then you will be going to St. Luke's hospitals, and you will be seeing doctors who are employees of St. Luke's. If you are outside of Johnson and Wyandotte counties, Medica has a very large network that allows you to see most providers. Cigna, and Cigna is participating in Missouri this year again. They were established in 1982. They're number 70 on the Fortune 500 list as of this year. Locally, their plans are operated on an EPO network. It is called the Cigna Connect Network, with about 10 hospitals and a little over 3,500 providers in the network. This is not important, but in 2017 they require paper applications when enrolling off of the marketplace, meaning if you're not going through healthcare.gov. It's not widely important because in 2018 all plans will be required to be purchased on healthcare.gov. Here are the hospitals in the local area under the Cigna Connect Network: Children's Mercy, North Kansas City Research, Centerpoint Hospital, Independence, Menorah, Overland Park Regional, Lee Summit, and Belton Regional. So again, if you're familiar with the area, you see the holes in that network relative to hospitals. So pick out your plan based on your priorities. Let's talk about the annual enrollment period for 2018. The annual enrollment period, we are in it right now. That runs from November 1st through December the 15th. Virtually everyone with individual health insurance locally will need to shop the market for a new plan. So it's a crowded market, and these insurance carriers are seeing volumes like they've never seen before. This is another important point to go back to. Usually we talk in terms of on and off marketplace. Well, everyone who is going to be buying a plan is on the marketplace, because in order to actually purchase coverage, you have to go through healthcare.gov for 2018. Now, the Affordable Care Act allows for a special enrollment period for individuals losing credible coverage. This allows for enrollment into a new plan within 60 days of the coverage loss date. So actually, this is somewhat of a good thing, since there's so many people having to make these changes. This means that individuals who are losing their coverage at the end of this year, and they've received a letter from their insurance company, have until December 31st to apply for coverage that will start on January 1st. So if you're losing your coverage in the individual market, you actually have all the way until New Year's Eve to actually make a purchase for January the 1st. If someone is losing coverage on December 31st, they essentially have through the end of February to make an insurance purchase before being locked out of the enrollment period. So again, if you just didn't get it done at the end of the year, you can still apply in January to get a February 1st effective date, or you could apply in February to get a March 1st effective date. How to buy coverage. Everyone who buys credible coverage in our area will have to purchase their plan using healthcare.gov. Now, I'm not going to go through an example right now, but you simply would go to healthcare.gov or get assistance from someone who is versed in enrolling on healthcare.gov, which can be the marketplace directly at 800 318-2596, um, or you can just go directly on the healthcare.gov yourself, and you would be creating a marketplace account. Um, so I will get back to calculating premium tax credits here shortly, and showing you how to find your providers on healthcare.gov. Now, for anyone who finds their way on healthcare.gov and would like to actually self-serve and needs assistance with dealing with their marketplace plan once they are enrolled as a local broker, we're happy to assist you and help you with any of the administration of your marketplace coverage. What you would simply have to do is when you are enrolling in your plan, it will ask you if anyone is helping you. And while someone won't physically be there, you would just put yes, and then you would put agent or broker, and then you could put our credentials right here in the marketplace application. Most important thing is using my email address at the very bottom, Chris Goodwin at insuranceprosinc.com, and my national producer number, which is 489-1981. So that's going to allow someone in our office to actually help you once you do have a marketplace plan. But that's purely optional. Let's talk about premium tax credits. If you project a household income between 100% and 400% of federal poverty level, then you may qualify for a premium tax credit to help you pay for your health insurance premiums. This income figure is based off of modified adjusted gross income for your household. And that is typically line 37 from your tax return, and it's not your last year's modified adjusted gross income. It's the modified adjusted gross income that you project for 2018. So that's the number that you will use. And they're looking for that for your entire household. So your spouse's income counts as well if you are married and you, of course, filing jointly. And by the way, in order to get a premium tax credit, you must file jointly if you're a married person. Here is federal poverty level guidelines, and it really shows the incomes that are eligible for a premium tax credit. So if you're a single tax filer and you earn between $12,060 and $48,240, then you should see that you're eligible for some level of assistance with premium payments. You'll see that the yellow column at 250% is there because if you are at or below that figure, then the government is not only going to give you money to actually help pay for your premiums, but they're also going to lower your deductibles and your co-payments. So let's talk about some alternatives to buying individual health insurance coverage, because given the unfamiliarity with all of these new companies and the potential that they might not be suitable for some people in terms of the network, a lot of small firms may actually decide to consider one of several alternatives to purchasing individual health insurance coverage. First of all, you can migrate to a spouse's group coverage. In some cases, it's probably not a different bullet point, but you can go on to a parent's coverage as well if you're under 26 years old. You can go without coverage, also known as self-insuring. You can purchase short-term coverage. You can form a group plan if you are an employer. So let's talk about the first one, migrating to a spouse or parent's coverage. Small population of those who have individual coverage actually have that individual plan because it was a better value than just being on their spouse's or parent's policy. Now that the individual market is once again changing, anyone with the ability to participate in an employer or group plan should consider this option. It is a qualifying event, losing your coverage that allows you to go on that company plan. You're going to probably find that going back to the group plan is going to offer better terms with lower deductibles and out of pocket, and potentially, and just some of the more familiar insurance companies with a better track record. There's self-insuring. For the vast majority, self-insuring is really not a favorable option. The average hospitalization in our area is over $7,000 per day, and we regularly see claims of over $200,000. I mean, it's just there's a lot of risk in terms of self-insuring, so it's something to think long and hard about. Now, some people do consider self-insuring, and then they sometime later find that, wow, they really made a mistake and they would like to get some assistance from an insurance company. And if you are actually thinking about applying for insurance outside of your special enrollment period, then you are going to be locked out, and you're not going to be unable to acquire a credible plan that covers future needs, covers you for future needs. There's also purchasing short-term plan. If you don't find a satisfactory solution in the individual market, you could consider a short-term plan. Short-term coverage is designed to protect individuals from unforeseen medical risk while waiting for other coverage. These short-term plans are currently written for a period of up to 3 months. The advantages of short-term plans is they are relatively inexpensive, far less cost than a traditional insurance plan if you are not subsidized, and definitely less than having group coverage. They have very wide networks, so most short-term plans that you see operate on a national network, which allows you to go anywhere in the country, and just most doctors participate in these networks. The application process is very fast and easy. You're going to see probably 3 or 4 health-related questions, and your coverage can start the very next day. So if you start a short-term plan, in many cases, like if you do an application and answer the questions and without having to answer yes to a disqualifying question, most of these short-term plans can start the very next day, so at midnight. Here are the disadvantages of short-term plans. Pre-existing conditions are not covered, so short-term plans will not cover you for something that's already been treated or diagnosed. They usually have a look-back period and say, hey, have you had something treated or diagnosed within the last 5 years? And anything that you've been treated or diagnosed with over the last 5 years is not going to be covered, or some look-back periods are shorter. You do not have wellness coverage with these short-term plans, so your annual checkups, your flu shots, etc. Are not going to be covered. And you have limited or no prescription drug coverage. So some plans will say, okay, we're going to cover your prescriptions, however, you pay all of it until you've met the plan deductible. Other plans have co-payment benefits that's going to drive up the cost significantly, and your plan will look more like a traditional plan in terms of its cost. And if you're already taking something, then it's a pre-existing condition, so that drug is likely not going to be covered. Other disadvantage is there is a requalification required if you want to extend your short-term plan beyond 3 months. You have to requalify and do a new application when your plan is being exhausted. And if you had a claim with your current insurance company that's carrying your short-term plan, those claims can disqualify you from re-upping with that company for an additional coverage term. Also, short-term plans are not considered to be credible coverage. So under the Affordable Care Act, plans that are not considered to be credible will not waive you from penalties. So you may be incurring penalties. We're not going to go into that, but penalties are about 2.5% of your household income that is over the federal filing threshold. Maternity is definitely not covered on short-term plans. So if you are a pregnant applicant, you will be declined. If you're the spouse of a pregnant applicant and you answer the questions properly, you'll be declined. And if you somehow didn't answer properly but still had a maternity claim, then it is not likely that you'll see that you'll be covered. So let's talk about another option relative to as opposed to going and buying an individual plan, forming an employer group plan. Many people today participating in the individual market are firm principals who elected individual coverage based on one of several reasons. The size of the business. If you're a startup, maybe there's just only one or two people. In many cases, it's just a principal and their spouse, or you just have one or two employees, and you say, well, we're not going to go to a group plan yet. For some, administration and overhead avoidance is a reason not to do group insurance. A lot of times employers will bypass group coverage to avoid paying towards employee coverage and to avoid the administration involved with managing a group plan. And simply the value of the individual plan relative to group coverage has been a drawback from going with group. But of course, now that plans have changed, that's going to be different. In some cases, let's say a business owner may have opted into an individual plan that presented a better value than group options available in the market. So with the coming changes in the individual market, many small employers may be compelled to now consider a group option. You're going to see all of your familiar companies again, which is very comforting to most people, especially those who are utilizers and see their doctor quite a bit. Surprisingly, the pricing is very similar and sometimes better than what you will see in the individual market, and that certainly holds true with these new relative to these new plans. Group coverage can fulfill the needs of employees that are being displaced from individual health insurance. So, you're not only benefiting yourself as an employer who has a need, but just by simply offering group coverage, you're kind of being a hero with your employees. This is a really small example, a today example of how a very similar group plan can cost less than an individual plan. And that is actually exacerbated by the fact that this is a 2017 example, but in 2018, the individual plans have skyrocketed with these new plans with companies that you might not be as familiar with. The group plans haven't increased significantly, but as you can see here, the group plan is actually slightly better in benefit. It has a lower maximum out of pocket for this example that we pulled, and the price is lower. So here are some rules for originating group coverage. In order to offer group coverage, a business must have a tax ID number. So you need to be an LLC or a corporation. You must have a minimum of 2 full-time employees participating. Full-time employee being defined as someone who averages at least 30 hours per week. And if you're salaried, then there's an option of really, if you're 2 W-2 employees, that basically is going to qualify you. Missouri groups require at least one participating W-2 employee who's not the owner or their spouse. So to work backwards, if you're a Kansas group, and you and your spouse have a business and you're both W-2 full-time employees, then you can start a group. In Missouri, you can't just start a group with an owner and their spouse having W-2s. You need at least one other person. So it can be an individual and one W-2 owner who's not their spouse in Missouri. So more on group, let's just see. Unlike group plan requirements prior to the Affordable Care Act, today's plans do not require the employee to contribute toward individual premiums. So you can offer a group plan and you can say, hey, here are the rates, here are the plans that are available, and the employee can just pay the whole thing. employers are just simply required to pay the whole premium and withhold the employee's premium per pay period. Employers who do offer a plan are required to offer coverage to all employees at their company who average at least 30 hours per week. So you cannot discriminate and not offer your plan to somebody who is a full-time employee. Employers who do pay a portion of employee premiums are required to offer the same level of participation, or let's say contribution, to all full-time employees regardless of class or tenure. So to be clear, if you're going to pay $100 per month towards a full-time employee's premium, you have to offer $100 a month towards all full-time employees. You can't just pick and choose. Also, you can't say, hey, this person has been with me for several years, I'm just going to pay all of their premium, but for everybody else I'm going to pay $100. Now you got to apply the same premium, whether it's a percentage basis, like you're going to pay 50%, or it's a flat dollar amount. You have to do the same thing for all employees. As an employer, you can impose a new hire waiting period for full-time employees, up to 90 days of full-time employment. So you can't impose a waiting period of greater than 90 days. Employers who implement what's called a Section 125 arrangement can save on the payroll taxes for every dollar spent towards an employee's health insurance. Also, the employee is going to save 7.65% for every dollar that they spend towards health insurance premiums when the employer implements a Section 125 arrangement. Just a quick example, if an employee is covering their family and they pay $1,000 and you have a Section 125 arrangement, that employee is going to save $76.50 per month in payroll taxes, and so is the employer. So that's a fairly significant little add-on that you can provide to your employees. The breadth of group plans. When you consider a group plan, you've got a lot of options available. If you find, and we probably won't go through a marketplace example based on timeliness, but if you offer a group plan on the marketplace, you've got 8 options in Missouri, I believe. You got 10 options in Kansas. There are hundreds of options in the group market. So if you're operating group coverage, I mean, there are lots of plan designs across several companies. So those are just some examples. Most insurance companies allow multiple plan designs for groups with as few as 2 employees. So this allows for different plan options for employees and their families based on their budgets and priorities. So if you like a $1,000 deductible plan for yourself, maybe someone in your company doesn't want that. Maybe they want a $5,000 deductible because they're a low utilizer, or just maybe that plan is more aligned with their budget. You can have multiple plan designs within the same group. It's fairly easy for an employer to acquire virtually all plans available to their group. It's really simple to start a group plan. You just really need a group application and a couple of employee applications, and in some cases proof that your employee is actually W-2, and a few days later that you're implemented. So it's very easy. You should consult with a professional who can help you determine the features and benefits of these plans, because you want to become familiar with all of the features. Now, we've been talking about fully funded group plans under the Affordable Care Act for groups of under 50 employees. With the fully funded plans, these insurance companies price the plans exactly the same for all small groups in our market. So if you have a group of under 50 employees, they're going to give you the same rate as the other company down the street. So it doesn't matter the health of your group. If you're a low risk population for your company, you're going to get the same rates as a high-risk population. So these rates might not reflect your group's health, um, which is why we want to talk about level-funded plans. Over the past couple of years, insurance companies have introduced partially self-funded plans or level-funded plans to employers with as few as 4 employees participating. So what these level funded plans do is they operate and they look exactly the same as a group plan that we just talked about, just showed. However, you can save as much as 60% when going through an underwriting process if your group is healthy. So again, groups must qualify for the final rates of a level funded plan. So you're simply completing applications, and then the insurance company gets to assess the health risk of your group based on the health of the employees. The individual insurance company will use the employee applications and other available medical information to determine your group's eligibility. Again, a really healthy group, a relatively healthy group, can save a lot of money. And again, it takes a little bit larger group, at least 4 people. But as you can see here, this is just very two similar plans. An Aetna example where they're saving 45% by going through the underwriting process. Not everybody can do it, and also not everybody is healthy enough to do it. So, unlike with the fully funded plans, if you're buying a fully funded plan and we're looking at the rates, then those are guaranteed to be your rates as long as you have a W-2s. With a level funded plan, you are going to, you could look at some really nice rates, and then after the underwriting process, your group can be disqualified if the insurance company doesn't think that your group is going to be an acceptable risk. But that doesn't disqualify you from actually going back to the fully funded options. So, with level funded plans, the employer group can even customize benefits such as co-payments, deductibles, and out-of-pocket. So a lot of times you can choose what co-payments that you want. You can say, oh, I like this plan, but can we make the co-payments higher? Because that's not important. We want to lower our costs. Or, hey, can we make these prescription drug co-payments a little bit lower? This is not the case with fully funded plans. You're just going to pick from the plans that are available. One other difference is the rate structure. Fully funded plans are going to have a separate rate for every age, but level funded plans are composite rated, so you'll see that they'll average the demographics of your group, and they're going to give you one rate for all employees. So this is great for administration. They might, as an example, $304.57, no matter how old the employee is. Once that somebody comes on, whether they're sick or healthy, they're going to acquire the rates that the group is already qualified for. So we do now, that's going to provide some administrative ease. Looking back at this example, you see anyone who's an employee only has $266 rate over on the right column. Anyone who is a full family is $918 versus the various rates based on the age of the family members for each of these examples. So, final word on level funded plans. It's important to understand that level funded plans function just like fully funded plans, and there's no additional risk to the employer or the employees. Groups who don't perform well, meaning they have a lot of claims under a level funded plan, they could be discontinued at renewal, but you'll have plenty of notice, and you may have to just go back to a fully funded plan. I just like to say fully funded plan is like buying a computer that's already put together, but then a level funded plan is like putting all the pieces together and getting all the features that you want and customizing things a little bit, but really it's going to work exactly the same when you're using the benefits. So in summary, with the changes to the individual market, startups operating with individual coverage have several options. You can select from the limited individual plans for 2018. You can elect to go on a spouse's coverage with their employer or perhaps your parents. You can self-insure, or you can buy short-term coverage, or you can elect group coverage. I say employer consent required, so if somebody is um, viewing this and they're not the actual employer, then you probably need to talk to your employer about whether or not a group plan would work for them. So buying group coverage allows for more options and potentially better pricing than individual coverage, while delivering some tax saving opportunities for both the employer and the employee. Um, if a group has at least 4 participating employees, they can even consider a level funded plan that can save them as much as 60% from the cost of a fully funded ACA plan. Contact a professional for how individual or group coverage can benefit you or your firm for 2018. At Insurance Pros, we're very happy to assist startups with meeting their group health insurance needs and priorities. And we can be reached at 913-944-4465, or you can email us at questions@insuranceprosinc.com. Danny or I will be happy to work with you and assist you in meeting your needs and your priorities. Thank you very much. We hope this has been really helpful, and we may even try to do something separate since this ran fairly long. This is a 41-minute, 42-minute presentation. We might try to do something to give people some help with the maneuvering the marketplace. Thank you.